Hello, everyone. My name is Evelyn Arana. I'm a research assistant professor with the Supportive Care and Cancer Division at the University of Rochester Medical Center. This month's God Health Talk is on cancer health disparities among U.S. Latinos. Today, you will learn about inequities that Latinos with cancer face in the U.S., from diagnosis to treatment, why these inequities exist, and what we can do about them. Although Latinos have lower cancer rates than the non-Latino population in the US, cancer remains the leading cause of death among Latinos. Latinos have high rates of cancer risk factors, including obesity and type 2 diabetes. This is partly due to their lower access to healthy foods and being less physically active. Latinos in particular face a 142% projected rise in cancer by the year 2030. And also by that year, 18% of cancer survivors will be Latino. Here we have estimated new cancer cases and deaths among the US Latino population. If you look at the top left corner of this figure, you can see that among Latino males, prostate cancer is the top cancer diagnosed among Latino males at 22%. If you look at the top right, among Latina females, breast cancer is the top cancer diagnosed at 29%. If you look here at the bottom left at estimated deaths, cancer deaths among Latinos, lung and bronchus is number one at 13%. And among Latina females, breast cancer is the leading cancer death at 14%. Here we have differences in stage at cancer diagnosis. I want you to look at the top left corner here. This graph here shows female breast cancer. And we are comparing here Hispanic or Latino versus non-Hispanic whites. The orange or brown graphs are the Hispanic population, whereas the gray bars are the non-Hispanic white populations. So if you look at the female breast graph, you can see that a higher rate of non-Hispanic whites have breast cancer diagnosed locally compared to Hispanic women. But if you look then at regional and distant diagnosis, you can see that Hispanics have a higher rate of these diagnoses compared to the non-Hispanic white population. And if you go down to the bottom left corner at prostate cancer, you can see a similar trend where non-Hispanic white men have higher rates of diagnosis of a local prostate cancer diagnosis compared to Hispanic men. But when you look at regional and distant, Hispanic men are more likely to have that diagnosis compared to non-Hispanic white men. And you can see this across the board with almost all of these cancers, where Latinos are more likely to be diagnosed with a regional or more advanced stage of diagnosis compared to the non-Hispanic white population. And so Latinos are more likely to be diagnosed with more advanced stage cancer. There's also longer time to definitive diagnosis and treatment initiation among Latinos. And this may account for an increase in cancer treatments, such as chemotherapy or radiation. And having more of these treatments may lead to an increase in treatment-related toxicities, including pain, cognitive impairment or memory loss, or cancer-related fatigue. Here we have 5-year survival rates. If you look at this graph, you see different types of cancers here. And again, we're comparing the Hispanic population between non-Hispanic whites population. You can see that across the board, Latinos have a lower 5-year survival rate than the non-Hispanic white population. Now, when we talk about cancer treatment, there's a few inequities that exist. Latinos are more likely to delay the start of their chemotherapy or cancer treatment regimen. Why is this? Well, there's a few barriers, there's a few challenges in access to care. Latinos may have lower rates of health insurance. They may have cultural or language barriers. They may have limited work flexibility or medical leave. They may be of lower socioeconomic status. And Latinos who receive cancer treatment, as I mentioned earlier, usually receive more of it because of their advanced stage of the diagnosis. Also, Latinos are more likely to not complete their cancer treatments, likely due to the challenges I mentioned earlier in the slide above. So what can we do about this? We see that Latinos are being diagnosed with advanced stage cancers. We need to help Latinos screen earlier, and so that they can have an earlier stage of cancer diagnosis. This involves increasing their access to cancer screenings, increasing their knowledge of the benefits of cancer screening, helping to shorten the time intervals between screenings, and having timely follow-up of abnormal results. Another powerful tool is to leverage promotoras de salud. This is a Spanish word or phrase for community health workers. These are trusted individuals who empower their peers through education and connections to health and social resources in Spanish-speaking communities. These are individuals who can help Latinos tackle the barriers that are in the way of them receiving screening, timely follow-up, and frequent timely screenings as well. So leveraging the use of promotoras de salud can be a very powerful tool. Regarding clinical trials, we also need to increase the number of Latinos in cancer clinical trials. Currently, only 2 to 3% of clinical trial participants are Latino. We need to make clinical trials more culturally and linguistically appropriate for Latinos. We also need to train the healthcare workforce on cultural competence and cultural humility. We also need to train them on diversity, equity, and inclusion principles. Together, these recommendations can lead to equitable care for all cancer patients. Thank you.